So XaTek is a pre-revenue clinical stage diagnostic device company that was launched in 2016 after we licensed the technology from our partners right down the road here at Case Western Reserve University. Before we take a dive into the device, the technology, let's start with good practice of ethnographic study and identify the clinical need first. Firstly, there are numerous clinical scenarios where there is no available diagnostic tool to provide clinically actionable data. I choose my words carefully there. Secondly, there's no universal point-of-care diagnostic available today to give any kind of picture of the global hemostatic process. When you combine these two needs, you develop a very compelling market opportunity story for fulfilling unmet needs in conditions that can be life-threatening. So what is the solution to these problems? The solution is the clot chip, as we call it. By definition, it is an in vitro diagnostic global assay that measures the hemostatic process of virtually any patient out there. And so some of these needs that you see here are unmet needs in the clinical space where there really is no diagnostic tool to support clinicians in their treatment of these patients. Drug-induced anticoagulation therapy's fancy way of saying anticoagulation. You might recognize a new category of what we call target-specific oral anticoagulants by their trade names. Those would be Xarelto, Eliquis, Pradaxa, that category. Also effective in antiplatelet therapies, aspirin-based therapies, congenital coagulopathies. So that's inherited disorders such as hemophilia, could be A, B, C, and they have different factor deficiencies associated with those. Trauma-induced coagulopathies. When you have system-wide trauma, for sometimes unknown reasons, you end up in a coagulopathy that is very difficult to follow, treat, diagnose, all of the above. And then also bleeding of unknown origin and as a pre-surgical screening tool. XaTek is currently in discussions with several global companies on all of these market opportunities. So let's look at the technology. This is an actual image of the device. It is a handheld, fully connected, Bluetooth, Wi-Fi enabled point-of-care device. It's based on something we call dielectric spectroscopy, which in other words is the measure of the impedance of an electric current across a field. It's fully electrical. There's no moving parts, so that makes it conducive to being a point-of-care device, unlike some of the other assays that you might find in the space. It uses a single disposable cartridge requiring a very small drop of blood, sensitive to the entire hemostatic process. It can discriminate between factor disorders and platelet disorders, can assess the bleeding profile for virtually any patient. Let's take a look at the technology itself a little closer here. So essentially, you're placing a single drop of whole blood, in this case a capillary finger stick, into the inlet. It crosses across the sensor via capillary action over that gold-plated sensor, which is where the measurement of the impedance of the current is quantified. That produces two very predictable data points. One is the maximum permittivity, which is what we call T-peak, or the peak of that curve, and the other is the maximal decrease in that curve that you're going to see from the slope on the backside of that curve. These represent very well-known occurrences in coagulation. So even a more granular look, where's this all happening? It's happening at the red blood cell membrane. It's something we call interfacial polarization. It's representative of red blood cell aggregation and deformation. Some clot chip clinical data points. These are all studies that are either been completed or are ongoing, have been presented at national conferences around the country. Specifically, I'm going to touch on a few. We've exhibited a high degree of sensitivity to the anticoagulant effect of those target-specific. They're also called direct oral-acting anticoagulants. We have exhibited sensitivity to identify bleeding phenotypes in hemophilia care. This is something that's never been done before. Ongoing research is in hemophilia, the 10A inhibitors, and as a general screening tool. At the close of the spring next year, we're going to launch a large multi-center trial that's anticipated to include 20 centers around the US and Canada that will look at the capability of identifying bleeding risk to patients who have taken off 10A inhibitors and need to undergo an invasive procedure. That could be anything from a tooth extraction to a cath. And then we're also working on designing a hemophilia trial and are talking with various strategic partners about that design right now. As I said, our research has been presented at the national conference to a jury of our peers for the last 4 years running. We have several papers that have been published, another one that has been accepted for publication, and a fifth that is under review currently. Can't do this all alone, right? So there's a team. We have kept this team purposefully lean and virtual. We leverage our partners in the area as well as consultants throughout the region. Most importantly, our clinical steering committee is made up of key opinion leaders from around the world whose names would be recognized from anyone coming from hematology or cardiovascular medicine. We aggressively set out on a timeline. We have stayed on that timeline and stayed on budget since 2016. And in recap, because I'm about to get the hook here, again, we founded the company in 2016. It was funded in a seed round. We then did a Series A round for $9.1 million in the spring of 2018. That round was oversubscribed in less than 90 days at a post-money valuation of $17 million. And we are contemplating a Series B in a little more than a year from now. That raise and valuation will be determined at that time.